I'm a partner here in Luton. I've been a partner for 4 years, but I've been working as a GP for just over 10 years. My patients in Luton come from a very diverse background. We have many different cultures and languages spoken, and that makes it a really interesting place to work.
I'm a general practitioner working at Lea Vale Medical Practice. We are a medical practice with a patient group of just under 25,000 patients working within a multidisciplinary environment across 3 different sites.
I'm a GP registrar, ST4. I work part-time here and I work part-time with the CCG, and I also do a degree at Cambridge.
I feel that discharge information is probably the only link that occasionally we have between primary care and secondary care. Whether it be from the hospital, from the subspecialities, or whether it be from accident and emergency.
It's a very critical point. The patient's care is ended at that stage in hospital and it's transitioned to the community. And there's loads of players involved, loads of organisations. And so getting that right is very important, and one of the most important tools to getting that right is having a good discharge and a good discharge summary, so people like myself could have all the comprehensive information available to us so that we can then carry on the care.
The patient benefits from a good discharge summary in many ways, I would say. They're able to relay what has happened to them, their journey that they've been through, and the GP who's not been privy to that previously will be able to get a better understanding of what has happened and ultimately what they've been told for the future.
If a discharge summary is done well, then I think it helps a patient to understand what's happened and what's going to happen. When they're in hospital, sometimes they might be quite unwell or confused, or it's all very overwhelming, so they don't always take in the information even if it's been told to them at the time. So I think it's really helpful for them to be able to take that information, and particularly with the list of medications, so they understand what drugs they're supposed to be taking.
I'm a firm believer that all information should be made transparent to the patient, because it's their record, it's their health, and it's a way to empower them to understand their body, to understand themselves and make the right decisions.